Hi, I'm Dr. Soosan Jacob, Director and Chief of Dr. Agarwal's Refractive and Cornea Foundation, Chennai. And I'm going to be just explaining what keratoconus is to you today. Keratoconus is basically a disease that affects a lot of young people now, with an incidence reported to be between 1 in 2000 to even as much as up to 1 in 20, which is really high. And in India, because of the amount of UV exposure that we have, which is now thought to be one of many postulated factors, because of genetic reasons, because of eye rubbing, and because of all these things, we do see a lot of keratoconus patients. Some of them are picked up accidentally when they come to the hospital for a routine checkup, and some of them come just because they cannot see clearly, or they're having very frequent change of glasses, and they find that they regularly need to keep on changing their glasses. Now, keratoconus is basically a conical protrusion of the cornea, and this is a progressive condition, so it keeps on becoming more and more conical, and it's like looking through a distorted lens. So whatever the patient sees is not clear, and that makes it very difficult for the patient to be able to get a clear view of what he's seeing. And since this is going to keep worsening as the patient becomes older, it is really imperative that this condition is treated. So now the good news is that this is probably the best time in case you're going to have keratoconus to be having it, because the amount of treatment and the variety of treatment that is possible today is really so much, and such quality treatments as compared to a few decades ago. And so even if you have keratoconus, you are likely to be able to be treated extremely well and with good visual rehabilitation. So there are a lot of treatments available, and one of them is crosslinking, which is basically making your cornea stronger so that it does not keep protruding out more and more. Now, I see a lot of patients who say that they've been told that crosslinking cannot be done for them because they are in a more advanced stage of keratoconus. But I'd like to request all of you that it is important that you know that there are advanced forms of crosslinkings also available. For example, contact lens assisted crosslinking, which allows even very thin corneas to be crosslinked safely. So that's one of the things that can be done, which is basically to try and stop it from progression. And the other thing that can be done is basically a flattening treatment. So crosslinking is a strengthening treatment, and the other treatment is a flattening treatment, which means that you're basically trying to reverse the keratoconus by a few years. It's almost as though you've caught it earlier than when it was actually caught, and so your visual quality can be better. So flattening treatment can be done by basically a treatment that we call as CARES, corneal allogenic intrastromal ring segments, which flattens out the cornea and therefore increases the visual quality and the quantity, even uncorrected without glasses as well as with glasses. This can be also done in very advanced cases, and that's one of the good news, that today we are able to perform a combination of CARES and contact lens assisted cross-linking in very advanced cases which otherwise would have gone in for corneal transplantation. So we're able to avoid corneal transplantation in such cases with very good results. The other thing, of course, is if you have very advanced keratoconus, you might need to undergo corneal transplantation, which also there are very advanced ways to do it. You can do lamellar keratoplasties, which means partial keratoplasties or partial corneal transplantations, where the most vital layer of your cornea, which is the endothelium, is retained and only the superficial layers are transplanted, which gives you a lot of advantages as opposed to all of them being transplanted. And the last thing I'd like to tell you, of course, is about a condition called eye drops, which some patients who have got very advanced keratoconus are unfortunate to have, which is basically a tear in the inner layer of the cornea, which leads to a sudden whitening of the cornea and pain and sudden decrease in vision. And what I'd like to say is these patients can now be treated with immediate primary pre-decimetic keratoplasties, which is a special way of doing it with very good results and with no scarring on the cornea. You can also have visual rehabilitation in various other forms for keratoconus patients. You can have a lot of advanced forms of contact lenses which can be used. You can have secondary treatments in the form of phakic-IOLs and so on and so forth. But remember that the first and the primary aim is to strengthen the cornea and to flatten it, and only post that should contact lenses etc. be considered for visual rehabilitation. For older patients, you can also do pinhole pupilloplasty, which is a newer technique. Thank you.